Tonight on KQED Newsroom, President Trump signs the largest relief package in U.S. history, a lifeline to our economy as coronavirus cases spike and governors plead for help. Also, healthcare workers around the nation, including California, are in urgent need of critical supplies to protect patients and themselves while bracing for a surge of new infections. And how communities can come together in the age of social distancing. We'll see how a group of young volunteers are helping neighbors in need. Good evening and welcome to KQED Newsroom. I'm Priya David Clemens. We begin tonight with the federal effort to mitigate the economic fallout from the coronavirus. President Trump signed into law today a $2 trillion economic relief plan, the largest in the nation's history, for industries, workers, and hospitals devastated by a virus that's affected every state. On Wednesday, the Senate unanimously passed the bill after Democrats won concessions like increasing unemployment benefits for workers. Also this week, President Trump said he would like to see the economy reopen by Easter. But California Governor Gavin Newsom thinks that's too soon for the state. School districts in the Bay Area announced they would stay closed at least until May 1st. Joining me now by Skype from Washington, D.C. is California Congressman Adam Schiff. Congressman, thank you so much for being with us today.
Thank you. Great to be with you.
So the stimulus bill is intended to provide relief to all levels of society. Can you speak specifically to how it will help Californians?
It'll help California a great deal. First of all Californians and indeed people around the country will get checks almost immediately. Those are the cash payments, so $1,200 for adults, $600 for children. But it will also help people in the gig economy, non-traditional workers, a lot of them, for example, in the Bay Area, but also in Los Angeles that work in the entertainment industry that don't have traditional employment relationships that work from contract to contract. It'll also help small businesses all over the state make payroll, pay the rent, pay utilities, and it will also help some of the larger industries. So on the economic side, there's a lot for California. California will, because it's a large state with large population, get more than most of the other states. But it also will provide vital billions for those on the front line in the healthcare system, hospitals, clinics, to be able to keep their doors open, see more patients, obtain protective gear. So overall, will be very good for California.
When you say almost immediately, what sort of date are you putting on that? When will the checks actually be in people's hands? My understanding is that we're looking at several weeks out.
Well, it depends on whether people have electronic deposit or not. Those that will have, for example, in an ordinary circumstance, their tax refunds by electronic deposit will get their checks quickest. Others will, yes, they'll have to wait weeks to get those in the mail. But those will probably be among the first payments to go out. Also, in terms of unemployment compensation, we extended unemployment compensation. We enhanced the amount of unemployment compensation on top of what the state ordinarily provides. For 4 months, the federal government will provide an additional $600 on top of that. That is retroactive back to, I think, January 27th. So people should go online to apply with the California Unemployment Office, and there will be a more generous than usual unemployment benefits, I hope, for the duration of this crisis.
Congressman, when do you expect that we'll be able to tell if this stimulus has been effective or if there are more steps that are needed?
I think it's almost certainly going to be the case that more steps are needed because the economic disruption is so immense. So I think many of us view this as just another step. This is the third package we have passed in as many weeks. But we're going to have to do, I think, more for the states, more for cities, more for college students, more for the homeless, more for those that need medical care. So I don't view this at all as the end of the story. I think this is just a very large package, yes, but the most immediate needs that we're trying to meet right now.
You know, we've heard about shortages of testing kits, of ventilators, of masks, and President Trump today invoked the Defense Production Act to compel General Motors to make ventilators after negotiations had broken down between the administration and GM over cost. Do you think, in your opinion, the Defense Production Act should have been put into place and used earlier, or do you think that this timing worked? And how else do you think it could be used?
Yes, I think it should have been used earlier. The administration has been late on just every aspect of this, initially because the president didn't take the threat of this virus seriously, tried to down talk it and talk about how it wasn't really going to be an issue here. Then quickly moved to claiming to be a wartime president, and then almost as quickly backed off and said that he wants businesses to essentially reopen around Easter once the church is full on Easter. Well, we would all love to see that happen, but that is not what scientists and epidemiologists tell us is supported by the evidence. And our solution has to be evidence-based. But he has also vacillated on the need for protective gear and the need in particular for ventilators, even as recently as yesterday, last night, downplaying how many ventilators states were going to need, saying he didn't really need to invoke the Defense Production Act, and of course having an about face today. So yes, it's a necessary step. It's been too long in coming, and the mere invocation of it, though, is not the end of the story. He's now got to make sure that companies work with each other, that they get the parts that they need, that the ventilators go to where they're most needed, that the states aren't in this race and competition with each other, that the federal government can really help logistically.
President Trump has also been holding daily briefings about the federal response to the coronavirus. What stands out for you about those briefings and in comparison perhaps to the briefings on the more local state level by Governors Gavin Newsom or Andrew Cuomo?
Well, the briefings by Gavin Newsom and Governor Cuomo have been excellent, very informative, I think very fact-based. The news conferences by the president have become less and less valuable over time. Frankly, whenever Dr. Fauci isn't speaking, there's not much value to be derived. They're turning into a kind of a self-promotional opportunity for the president during this crisis, and they become increasingly difficult to watch. So I wish, frankly, they were focused more on the experts than a substitute for the president's rallies. But I think what the governor's doing, what Governor Newsom has done, has been enormously important and effective in pushing out good information.
Congressman, a lot of Californians are feeling anxious right now and are struggling with sheltering in place. What would you have to say to them?
We're going to get through this. We've been through more difficult things in our nation's history. And yes, this is going to be disruptive and difficult, and it's going to get harder before it gets easier. But I have every confidence we're going to get through this, and we'll get through this together. We will rebound as an economy and as a state. We'll once again have the opportunity to congregate with the people that we love. But for now, we're all going to have to maintain discipline. We're going to have to maintain our distance. We're going to have to find ways to occupy ourselves within our homes. But this too shall pass.
California Congressman Adam Schiff, thank you so much for joining us today.
Thank you.
This week, San Francisco warned that the number of coronavirus cases in the city will surge in the next week or two. Also, the city recorded its first 3 deaths from COVID-19 this week. On Wednesday, Mayor London Breed and health officials said the city may need 5,000 more hospital beds and up to 1,500 more ventilators to treat a surge in cases. There are some additional resources coming soon. Mayor Breed says San Francisco has hired 82 new nurses and will receive 1 million face masks. This as hospitals in the Bay Area and around the nation face severe shortages of critical supplies. Joining me now by Skype is Krista Duran. She is an emergency room nurse at Zuckerberg San Francisco General Hospital. Krista, thanks for being with us today. I appreciate it. You just came off a shift. Can you tell us what it's like there on the ground at the hospital right now?
Yes, I can. I just got off of my shift yesterday, and it kind of feels like the quiet before the storm or the calm before the storm. We are doing a lot of preparation for what we see that's going on in New York and Italy. And so right now we're not seeing a huge surge, but we're expecting one in the next couple weeks, and our staff are mentally preparing for that.
Mentally preparing, but what are the physical activities that are taking place to prepare?
Our biggest concern is having enough personal protective equipment. like masks, gowns, and goggles to protect us from being vectors of the virus. So right now we're asking a lot of questions about how to get that. As far as the number of patients that we're seeing, the patients are coming in sicker and sicker. Our hospital can bed about 179 patients, and currently, as of yesterday morning, we had 174 of our beds filled. That's of all types of patients, not just COVID. I would say about a third of those patients were patients under investigation for COVID. And we are having positive results of COVID.
And Krista, how are those patients being treated, and how are they being kept separate from other patients who are there?
Yes, in the emergency department, we are still kind of fine-tuning that. We have started screening every patient at the door for those type of symptoms, and if they screen positive, every patient is receiving a surgical mask. And if they're really, really sick, they're going to go to a private room. If they are not so sick, they're going to a COVID triage area, and we are going to do a little bit more questioning, and they might be sent home to self-quarantine.
You mentioned concerns about having enough personal protective equipment, and I want to ask you about that. We also talked with San Francisco General's spokesperson, Brent Andrew. We wanted to find out about the availability of critical supplies there. We know nationwide this is an issue as well. So Brent Andrew told us, quote, that we have been actively acquiring supplies from our typical sources and many others. In addition, we are diligently managing the use of those supplies to ensure we have adequate stores. Does that line up with what you're experiencing at the hospital?
Currently, in the emergency department, we are rationing our personal protective equipment, which means that we are usually using an N95 mask for our entire shift if we're not seeing a high isolation patient, in order to avoid running out. So right now we do have enough, but I don't think Brent Andrew is correct in saying that they are working hard. I think that we need to be reaching out further to the public. And when he talked to, I believe it was ABC7, he told them that we were not accepting donations at SFGH, and that was very concerning to me.
Why are you concerned that donations are not being accepted?
Because we currently have gotten an announcement that we're going to get a lot of PPE, but we haven't seen it yet. So it would be in our best interest to accept what is offered to us from the community right now.
So, Krista, what you're saying seems to me to be is that you do not have faith in the management there, that they are doing all they can to protect you. This is a situation in which I'm sure everyone wants to do the best they can. Do you feel like your management should be doing something else? And what is that something else?
This is a national problem, but I also think that it is a local issue. We are a public health, we are the safety net of the city at San Francisco General. And I think it's important for them to remember how important it is that if we become vectors of the virus, then we cannot care for the public. And we need to protect the healthcare workers in order to be able to handle that. So, and in answering your question, I think our administration has failed to hire enough staff in order to handle a surge. They've failed to hire enough staff just on a regular day, because we've been working as a disaster level care center on critically low staff for many, many days.
So let's get to that, because Mayor Breed has announced that there are 82 more nurses who have been hired and that there are more to come. Does that feel like it will help fill the need? Is that enough?
It depends on what those nurses' specialties are. I think those 82 nurses are spread out between departments. And what I've seen is in order to care for these respiratory COVID patients, we're going to need a lot of ICU and emergency room specialty nurses. So I don't know how many of those are specialized in that department. So no, I'm not sure it's going to be enough. And I don't think we have enough ancillary staff as well and respiratory therapists who are going to be vital to caring for COVID patients.
Krista, what's your biggest fear in the coming days as the hospital braces for a surge of new coronavirus cases?
My biggest fear is that we're going to have to pick and choose which patients we care for if we get overwhelmed. We only have 60 ventilators in our hospital, and I hope it's enough. And I don't want to have to be in a situation where I choose one patient over another to care for.
Krista Duran, thank you so much for being with us. Stay safe out there, protect yourself, and we thank you for the work you're doing on the behalf of the community.
Thank you.
Most San Francisco residents appear to be staying at home and socially distancing, but will it be enough to help hospitals facing a new wave of infections? Joining me now is Dr. Ayanna Bennett, a member of the command staff at the San Francisco Department of Public Health. Dr. Bennett, thank you so much for joining us. I want to jump right into this question about personal protective equipment. We know there's a nationwide shortage of masks, of ventilators. We've just heard from a nurse here in San Francisco who's worried about running out of critical supplies. Do we have what we need, or will we be able to source it in time for this expected surge in cases?
We do have what we need right now. We are asking in every avenue we know how, from the state, from the federal government, from private vendors for more, because we do know that we do need more when the surge hits. So we are both prepared now and looking forward to needing more to prepare for the future.
The nurse we spoke with also said you were not accepting donations at SF General. Is that correct?
I'm not sure what that means. The city is accepting donations. Whether or not they are being dropped off at her particular site as the donor site may be what she's thinking, but we are in fact accepting donations. And they are going to San Francisco General, among other places.
Okay. Donations of masks, of gloves, those types of equipment. Okay. The same nurse also told us her worst fear is that she and doctors at the hospital will have to go through making the sort of choices that have been made in Italy and New York, deciding who lives and who doesn't because there simply isn't enough equipment. How likely is that scenario here?
We have lots of projections that span the range about how to plan for how many people will need extra care. So I will broaden people's scope a little bit, that it's not just life and death decisions. The vast majority of people are going to be decisions about whether or not we're able to alleviate anybody's suffering, able to comfort anybody, able to prolong their stay outside the hospital. So we have a lot of layers of decision that are going to need to be made. None of us want to be in that position. And so we are getting new hospital beds. We are ordering equipment and doing the best that we can. But we do need help from outside sources.
So let's talk about that outside help. What else would you like to see the state and the federal government do?
So we have made requests for PPE equipment, for COVID testing equipment. I know that the plan is coming together around facilities and other things that we need, but that is a total plan that is coming together right now. The past asks have already been made for the testing equipment and PPE, and some of that has arrived.
We know that Mayor Breed has made a request for 5,000 more hospital beds and for 1,500 more ventilators. What's been the response on those requests? Are we getting what we need?
So we've made many requests over the last month, both for equipment and for various kinds of staff, and we have gotten some of those requests met. The new requests that have just recently been made, I don't believe that we have actualized those, but I do know that it is a minute-by-minute process, and we are getting responses as they come through.
Just today, San Francisco Mayor London Breed once again urged everyone to stay inside, to shelter in place, to only go outside for essential trips. Mm-hmm. Do you think we're seeing an impact to that sheltering in place? Are we seeing an effect from the work that people are doing by staying home?
So there are two effects. So the first is that we are seeing people further away from each other in a way that we know keeps them from being infected. So if you walk out on the street, everybody is very focused on the two people they do see or the small cluster of potentially family members, but I want them to focus on the people that they don't see. There are vast spaces between those people you see, and that is what we need to keep people from being infected right now. What we are looking for is that going to have an effect on the numbers that we see in terms of positive cases? The numbers you see today are not an indication of whether or not that activity has been effective, because those people were infected a week or even 2 weeks ago. What we're looking for is next week and the week after, do the numbers start to level and go down? And we expect that they're going to go up right now because we're expanding testing. So we're finding more people as we get more supplies and being more intentional about trying to get as many testing sites as possible. So you're going to see raises in the numbers that don't necessarily reflect more people being infected than were infected before or that we expected. But the numbers to watch are the numbers coming forward, not the numbers today.
Tell me a little bit about these testing sites that you're discussing and what we might be seeing in the next week or two.
So we're seeing a concerted effort from all over the medical community. So various different health systems have all opened testing sites. The department has several testing sites, and we now are opening with the city 2 testing sites for first responders. So we are looking at testing sites all over the city from one provider or another. We don't have a unified health system, right? So there is not a single person doing that. You are seeing all of the various health systems that have patients in the city trying to develop their own sites, and they're doing that successfully.
Dr. Bennett, thank you so much for being with us today. I appreciate it.
You're welcome.
It's been nearly 2 weeks since Bay Area residents were ordered not to leave their homes except for essential tasks like picking up medicine or food. But for some vulnerable residents, that can be tough to do while limiting their exposure to coronavirus. So Madeline Sue and 3 other volunteers launched a grassroots organization to help neighbors in need in San Francisco. From delivering groceries to seniors or just being a friendly voice to talk to, they are helping their communities stay safe but not isolated. Joining me now is Madeline Sue, one of the co-organizers of SF Community Support. Madeline, thanks for being with me today.
Thank you for having me.
Tell me about how your organization began and who you support.
Yeah, so we started almost 2 weeks ago now, and there's a team of 4 of us that started out. And basically we all met through Nextdoor because we had seen other folks voice similar interest around how we can corral all of the generosity and support that people had been voicing on there. So it started off as, how can we match a lot of this interest in helping each other out to how do we match that with some of the growing need that is going to exist in our community and connect that together. So in all, we're really trying to create a community where neighbors can support neighbors.
And it seems like this organization has also been bringing a lot of intergenerational connection that you didn't have necessarily before it started. Tell me a little bit about that experience, and have you yourself been helping out in ways that you can share with us?
Definitely. So I think this is a broader goal of how we think about our community and how we can take collective action together. And it's around, how can, let's say, Emily, who helps out Tom, not only be someone who delivers his groceries right now, but in a few months from now or a year from now, Emily goes to Tom's house and they play cards. They talk about how they can engage in civic policy and local organizational efforts around their community. And me personally, I've talked to a few different folks who've requested some support. And it's been anything from wishing someone a happy birthday to helping organize and provide the groceries. I think that's facilitating not only assistance, but longer term relationship.
What are the age ranges of the people that you're serving? We often hear that it's older people who are having trouble getting out, especially because they're more vulnerable. But do you find that this is help that you're providing across various ages, or does it tend to be in that senior community?
So it started off on the older end, but we've seen more and more people, because I think everyone has needs right now, ranging from, let's say 40s to upwards of like 80s and 90s, but definitely more concentrated on the older side.
Madeline, after a couple of weeks of helping your neighbors, how has this particular crisis impacted the way you understand community?
So I've always thought about community a lot in terms of shared interests, or where I went to school, or my job. But now I think a lot more critically about it in terms of my neighborhood and my local area, and how together we're dealing with this crisis. And for better or for worse, I've now become a lot more attuned to how we can support one another through these shared experiences.
Talk to me a little bit about how you're using technology to match the needs with the services you can provide.
So it started off very manual, anything from Google Forms to a spreadsheet, and more or less a lot of that is still the process that we're using. But as we expect more requests to come up, then we are going to be scaling our efforts and how we use other forms of technology as well, whether that's some sort of support matching technology, or whether that's, we started using Slack to coordinate our volunteers, to using Google Maps to help map out the different neighborhoods that people are volunteering in.
Now, some who may need help may not be quite as tech savvy. How are you reaching those folks?
Definitely. I think one of our biggest areas of focus is how do we meet people where they are, both on the volunteer side and on the support side. So in addition to starting off digitally with forms and such, we've been doing a ton of flyering efforts. And on the flyers, we have access to people's emails as well as phone numbers. So if you're somebody who receives a flyer but may not necessarily know the best way to navigate the internet, there's a number you can call. There's some other things that we're exploring right now as well, such as community partnerships with like grocery stores, things like that. Definitely in the roads.
How are you all making sure that you're staying safe as you are doing this work and helping each other?
Definitely very top of mind for us. And so we've talked to a handful of health professionals and seen what other organizations are doing. And we've created some guidelines for volunteers to adhere to. So we're keeping safety very top of mind and our first priority.
Madeline, Sue, thank you so much for being with us today. I appreciate it.
Thank you so much.
If you need help or want to help your neighbors in San Francisco with essential tasks, visit sfcommunitysupport.org. As always, you can find more of our coverage at kqed.org/KQED Newsroom. I'm Priya David Clemens. Thank you for joining us. Stay safe.